Welcome to the Business of Healthcare, a twice-monthly podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Britt Berrett.
Well, I'm delighted to be with Dr. Keith Thurgood. He's a faculty member at the University of Texas at Dallas at the Jindal School of Management, and he is the director of a master's program here, an executive education program for working healthcare executives. What we found is individuals have been able to advance their careers, but they've lacked the graduate education. So the program allows for working executives to take classes and earn that graduate degree. So a delight to have you with us, Dr. Thurgood. Welcome.
Thank you very much, Dr. Barrett. I'm glad to be here and talk about important subjects as it relates to healthcare. And just a word, by the way, the program is actually 1 year old this month. And we're excited about it because we've been able to bring healthcare professionals together. They come, they learn the great concepts and ideas. It's a growing program. The students absolutely love it. And what's more exciting is they're able to take some of these ideas and concepts and start to apply them immediately back in their healthcare system. So very positive.
Yeah, what I like about it, you've got the cohort model. So you have working executives in all spaces of healthcare. They're side by side. They're doing case studies and projects together on contemporary issues.
Yes, that's exactly right. The purpose of the program is to give these students a working knowledge of things that happen in the healthcare, how the business of healthcare actually happens. And so it's case studies, it's problem solving, it's a seminar type environment where we get to learn from every student and the students get to learn from these very accomplished faculty.
When you architected it, I thought it was fascinating you did it. The class is all day Friday, all day Saturday, once a month through the course of the program. And I think that's genius. I mean, if you're a working executive and you just haven't been able to get your master's degree, and the dilemma that I think we have with graduates is that to be promoted, you need that additional education. So it's better to get it now so you're promotable into the future. I remember when I was hiring staff, I'd ask that question, what kind of commitment to education do you have? And if they haven't earned a graduate degree, I think that put them at a disadvantage.
Yeah, and I think that's bearing out. If you talk to the students today, I think what you'll find is that many of the students recognize that they need a new skill set to lead in this new world.
Right.
They need to do things, learn things, have different kinds of experiences that enable them to be leaders of the future. And so this is one way that we can help them do that.
Well, they'll stay connected too. So at one of our previous podcasts, we had a student, a physician, anesthesiologist, bright guy, that went through our master's program that is exclusively for physicians. Now, this program has been in existence for 20 years. It's got chief medical officers and VPMAs across the United States that have taken this course and then have gone out and begun leading big organizations. The connectivity with UTD and the Center for Healthcare Leadership and Management allows a lot of synergy. You have physicians in your group as well, don't you? I think you.
Yeah. That's
interesting.
That's the great thing about the makeup of the students in the class. So it is for healthcare professionals, as you mentioned earlier, and about 35% of our students are actually physicians. So when we get into a discussion around what happens in a hospital, you have a very diverse point of view. You've got the physicians that have a point of view. You have the administrators and department heads that have a point of view. And so when you start to dialogue about this, it really provides great insight and changes the way that you think and may even change the way that you interact with others in the hospital system. So it's diverse, it's exciting, it's very, very interesting dialogue.
We live in interesting times. The healthcare spending in the United States is over $3 trillion, and as a percentage of the economy, we're over 20%. So 20% of all the dollars spent in the United States are committed to some part of healthcare, ambulatory, hospital, post-acute. Moving forward, there's a lot of conversation about the engagement of physicians and the nature of physicians. They're smart, they're scientists, they're very, very committed to their practice, but they have some changing to do. Talk to us a little bit about that.
Well, that's an excellent point. So when you think about the world that we live in today, I want to talk for just a minute, maybe highlight something that we learned in the Army in the 1990s. And it's this idea that we had that said, look, the world that we live in today is going to be a lot different in the future. So the world that we live in today is not a world where we're trying to solve problems with analytical decision-making tools. We're moving away from that world into a world that is rife with dilemmas that are hard to solve. Those dilemmas require a new skill set, a new way of thinking. It requires physician leaders to think differently and those in the healthcare to think differently. And in the Army, we used to call that a VUCA world. We still call it a VUCA world.
I'm afraid what that acronym...
Well, you might ask what VUCA means.
I'm a little worried, but for the G-rated broadcast, what does VUCA stand for?
It's actually the name of the salad that I had last night when at dinner. So VUCA, V-U-C-A, stands for volatile, uncertain, complex, and ambiguous. So I don't know of a better word to describe not only the world that we're in, but healthcare at large. And if you think about the Affordable Care Act, since 2010 really, you think about VUCA and the world that we live in, the healthcare industry at large, VUCA has taken on a totally new meaning in healthcare because we have these deeply embedded dilemmas that are hard to solve. And oh, by the way, the reality is, the dilemmas are not going away anytime soon. And it's magnified in the healthcare system, and we think about the realities of healthcare because, as you said, we have our doctors that are trained to practice the art and science of medicine, but not the business of healthcare. And so the world that we lived in the past is not the world that we're going to live in the future. And therefore, we need different skill sets. We need physicians and those in the healthcare system to think differently, to act differently, to navigate in this world of VUCA dilemmas.
Well, admittedly, healthcare has been very insulated. So I recall as a hospital president, I'd have a small entrepreneur come into my office and say, listen, I was sitting in your emergency room and your processes and systems are all screwed up. And I went to the doctor's office and scheduling was a disaster and this and that. And I look at him and I go, yeah, you're right, but there's so many issues and so much complexity. It is what it is. Those days are over. Consumers are demanding accountability and responsibility that we infuse into the delivery of healthcare more complex answers in what you describe as a VUCA world. Now, let's talk a little bit about the role of the physician in this because this is unique. They represent over 1 million physicians across the United States and are integrated into every aspect of the delivery of healthcare. What's the challenge for the docs?
Well, I would describe it as a bitter pill, right? Okay. It's a bitter pill that we in the healthcare world have to swallow, and physicians in particular. Why? Because as I mentioned earlier, physicians are terrific at the art and science of medicine. They're not so much, and this is a general statement I know, but not so much on the understanding the business of healthcare. And if you really want to drive sustainable change, it requires leaders to think and act differently. Therefore, we need leaders in the healthcare world to act and think differently. And where's there a better place to start than with the physicians?
I agree.
They can make a fundamental difference. Now, it's not to say, as you highlighted earlier, Dr. Berrett, that we don't want to focus on reducing the cost structure. We can't continue to have a healthcare system that consumes 20% of our GDP. It's a $3 trillion spend. And oh, by the way, a third of that, it's estimated, is waste. That's just unsustainable. So we've got to focus on the cost structure. We need to continue to focus on improving things like data transparency, aligning the clinical and financial outcomes, improving quality, all those kinds of things. But guess what? Those things don't happen by magic. There's no magic wand. There's no flow chart. There's no great book that you can go read. It requires leaders at every single level of the organization to make a fundamental difference.
You know, Keith, it's interesting for me when we have this conversation with physicians, there are a number of reactions. Number one, a doc will say, no, you shut up, right? Yeah, we're doing great. We don't need you business suits and ties to solve these problems. And my response is, no, you're not getting it. I'm not telling you that you're going to solve all of this. I'm saying together we're going to change. And another reaction is, yes, but where do I start? How do I move down this road? How do I engage in change? And then the third response is, I'm going to hide out for a while. I'm going to ignore this issue. I'm going to retire, so don't bother me, or I'm so insulated it doesn't affect me. I think we discard groups A and C. Let's talk about groups B. How do you engage in this process? If you've got a doc, a group of physicians, they're just smart, but the process and system, well, they've entered the VUCA. Where do you begin?
Great question, and I totally agree with you in how you've laid that out. And I think the second point that you brought up, the B group, is where we have to start. So the magic of leadership, if there is anything magical about it, it's the idea that it starts with me. So the problem is not out there. It's not the administrators. The problem is it's with me. So in order for me to drive sustainable excellence, in order for me to be on top of my game, in order for me to model the right kinds of behaviors that I would expect others to model in the healthcare system, it starts first and foremost with me. So this idea of self-leadership is super critical to get right. And therefore, we have to teach that. We have to teach people why it's important, because that's the cornerstone of driving transformational change and sustaining that over the long run.
And I think it's also true for administrators who have isolated physicians into little narrow categories to say, well, listen, you're the doc. You don't know anything about the other elements of the healthcare delivery system. Got it. Coming together to introduce transformational change. One of the concepts has become very prominent in the literature on leadership is mission and vision and value. So if you're sitting down with a doc, what kind of questions would you as an administrator ask he or she about their mission, their vision, and values? How would you engage in that conversation as a foundation for moving forward in a VUCA environment?
Well, let me back that up just a minute and say, we've talked about VUCA. Remember, VUCA is it's a volatile, it's an uncertain, it's a complex, it's an ambiguous world. So guess what the antidote to VUCA is? VUCA. What does VUCA stand for on the other side of the equation?
I'm dying to hear this. Go.
Vision, right? You absolutely have to have a path to the future. And you have to clearly articulate that. People have to buy into it emotionally and intellectually. So this isn't one of these vision or mission statements where the senior leaders go off to an offsite in Malibu and come back 2 days later and dump it on the organization and say, hey, guess what? Here's your vision. Go execute. That's not how it works. That's not gonna move the organization forward. So you've got to spend a lot of time thinking about your vision and your mission statement. The U is understanding. How do you stop, look, and listen? And what I've learned in my experience, both leading large organizations in the for-profit world and hospitals and even in the United States government, nobody's as smart as they think they are. Nobody's got a corner on good ideas here. Yeah. So the antidote for an uncertain world is developing understanding. I look, I learn, I listen. The antidote for complexity is clarity, making sense of all this chaos. So we live in this world of dilemmas. We have to attack it in a different way. We have to think about it a different way. And the antidote for ambiguity is agility. So we need leaders that are adaptive. They see the problems as they are. They address them as they are. And they develop what I would describe as a network of networks, a system of systems, a team of teams. Collaborating deeply at every level of the organization is how we're going to move the organization forward and drive the change that we need. Okay,
I need to know, is this a Thurgood axiom, or is this something you stole from someone else out there? Because it's genius. I love the VUCA. I mean, is this yours, or did we steal this?
I would love to take full credit for this, but VUCA actually started, as I mentioned earlier, with the Army, the first part of the VUCA, the volatile, uncertain, complex world, because the Army realized we can't have the kind of leadership models that we've had that sustained us through World War II. We need a different thinking. So it started actually in late 1990s.
Was the second part you're doing?
No, that wasn't my doing either. I'm sorry. Yes, it was. No, it was not. I can't take credit for any of that.
Well, it's genius.
So as this is developed, right, people have said, you know what? Actually, that makes a lot of sense because that's the world that I live in. And if you go talk to somebody at the lowest levels of the organization, they may not know the word VUCA,
Yeah.
Or VUCA on the other side is an antidote to VUCA. But what they'll tell you, they'll describe how ambiguous it is. I'm unclear on what I'm supposed to do. I'm not sure how my specific activities connect to the larger vision of the organization.
Well, in today's contemporary world, these acronyms are spot on and fundamental and foundational for us to address the healthcare ambiguity that we're dealing with. And the clarity that's needed is provided by strong leadership.
Yes.
Would you not agree?
I totally agree with that. And again, as we mentioned earlier, the first and foremost thing that we have to do is you got to look in the mirror.
Yeah.
Leadership starts with me. It starts with me being self-aware, being humble and grateful, right? It starts with me understanding the model and where I'm trying to take the organization.
What I love about the University of Texas at Dallas has been a concerted effort to bridge the gap between academics, the research, the analytics, and the professional world, the real world in which we live. And all of us have had real life experiences. Then we transition to academics and we say, listen, this is what we saw and heard. We've had some time to think and walk and think and ponder. And now we would like to invite you to consider as such. Your program's a perfect example of that. The audience may not know this, but a quick Google of Keith Thurgood will reveal that he's a retired 2-star general. He was responsible for much of the logistics in Afghanistan and in that theater of the world. And to see VUCA in action, where it was a completely ambiguous, complicated environment that you were able to make sense out of, was inspiring. And then also, Keith served as an executive with PepsiCo and Frito-Lay and others. We were able to lure him to the University of Texas at Dallas and the Jindal School of Management and to the Center for Healthcare Leadership and Management because of his passion to prepare the next generation of healthcare leaders. So let's talk about a couple bits of advice that you would give to the next generation of leaders. You've shared some great thoughts. What would you add to that as it relates to recommendations, counsel, guidance to that next generation of healthcare leaders?
Well, that's a hard question to answer, a broad question, but let me capture that in this context. And it's a quote from Alvin Toffler, the futurist, who said, "The illiterate of the 21st century will not be those who cannot read and write. It will be those who cannot learn, unlearn, and relearn." That is a major idea to think about living in this VUCA world. So one piece of my advice is be an adaptive leader, be flexible. Think about what has to be done. What strategies do we need to put in place to defeat the status quo?
I was inspired by, as I mentioned, we've had guests on this podcast. They're individuals just like that. They look at a process, a system, an issue, a concern, and they say there's a better way. Let's move from good, better to best. And it can be nothing more compelling than the delivery of health care to those that are sick and injured. What would happen if we were able to save resources and expand our capacity and capability? I've seen healthcare systems do that. They've gone from good, better to best. They've retained resources, and those resources are being able to be utilized to bless more lives. And so I commend you for that commitment. Other words of advice? You're like a walking acronym and an encyclopedia of thoughts and quotes. I'm just I'm in awe of you, my friend.
Well,
awe.
It's one thing to say something. So here's my last piece of advice. Right? It's one thing to say something. It's quite another to take a vision and turn it into reality.
True.
And that's why we need great leaders of character.
Yeah.
They can drive results. They get the results in the right way. That's how we're going to help the healthcare system and improve the quality, the cost, the outcomes that we all want, and have a great outcome for the patients at the end of the day.
Can't you feel the passion, Dr. Keith Thurgood? It's inspiring. I'm delighted to have you with us on this most recent podcast. We're grateful for your commitment and your dedication, the resources you provide, both personally and professionally, to the men and women that are joining this program. I can't imagine it being anything other than a fantastic experience. So On behalf of the University of Texas at Dallas, the Jindal School of Management, and the Center for Healthcare Leadership and Management, we're grateful for your time. If you have any more questions or thoughts or would like more information, Dr. Keith Thurgood can be found here on campus. Dr. Thurgood, could you share us your email address?
So my email address is Keith, Keith, .Thurgood, Thurgood. So think Thurgood Marshall at utdallas.edu. Would love to continue the dialogue, talk about our program, leadership at large, or any thoughts that you might have.
Very good. Thanks so much.
Thanks for joining us here on the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episodes, notes, links, and more. And be sure to subscribe to the Business of Healthcare podcast on iTunes or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institutes tab on the navigation menu. I'm Dr. Britt Berrett, Director of the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.